And we're live now. So good afternoon, everyone. This is Cook County Commissioner Donna Miller, and we just want to welcome you to our Facebook Live virtual town hall. So we'll give it a couple of minutes for the audience to build while we have our guests here who are going to speak with us today. And I just want to say hello to everyone, but let you know we'll start in just about a minute or two.
All right.
So we're going to get started in just a minute. I'm just letting everyone know we're waiting for everybody to join us on Facebook.
Okay.
Hi, everyone. I want to welcome you to our town hall series focused on COVID-19 in the Southland. And today our topic is on nutrition and exercise. And I am Commissioner Donna Miller, and I represent the 6th district, which includes the south and southwest suburbs of Chicago. And that's in Cook County. And for those who might be tuning in who are not from this area, just so you know, Cook County is the 2nd largest county in the country. And my district is actually right outside of Chicago, as I mentioned, but there's many cities outside of the city of Chicago. So I represent 36 different municipalities that are in the south and southwest suburbs. So today, our discussion on nutrition and exercise is really important because, first of all, we've all been at home a long time now, and some people are nervous eaters or quick eaters and not knowing what to exercise, over exercising because they want to try new things that they've never done before. I'm so fortunate to have some experts here with us today. Let's talk about what we can do while we're at home and beyond, because as we know, we're going to have a phased-in approach on how to actually come out of this. We're going to start going back to the new normal, as I'll say, the new normal. But just wanted to remind people in the audience as well that, you know, this is still a very hard disease, hard virus, hard process to go through, and we're not out of this yet. Just wanted to give you some numbers. In southern Cook County, well, in the suburban area of Cook County, which excludes the city of Chicago, there have been 18,457 confirmed cases of COVID-19. Unfortunately, there's also been 756 deaths. And over the last 5 weeks, there was just an article in the Tribune today that said the Southland records more than 100 COVID deaths for the 5th straight week in a row. So we are by no means really out of the woods yet. We still have to practice social distancing. We still need to stay home as much as possible, safe, and we still have to reiterate washing our hands. So those are just the basics that are still a huge focus of what we want to do. So I have 2 distinguished panelists with me today that are going to share their expertise in their respective areas. I have Dr. Mcdonald, who is a gastroenterologist at University of Chicago, and he also has other specialties in nutrition as well as culinary arts. And then we also have Curtis King Franklin, who is the owner of Overall Body and Fitness, and that's located out in the south suburbs. And I'm going to have them tell us a little bit about what they do, how they got into this field, some things they can do as we've been in this COVID-19 environment, and how we can actually get some ideas for people on what they can do to exercise at home, eat better while they're at home, and take that with them as we move out of this at-home phase. So first, we'll start with you, Dr. McDonald. Why don't you just tell us a little bit about what you do, what kind of patients you see on a regular basis, maybe has changed a little bit since we've been in COVID, and just how you got into your field. I think that's a little interesting as well.
Here.
Oh, you're on mute.
Can everybody hear me? So thanks again for having me on the live right now. I really appreciate the opportunity to talk to everybody about what's going on and also what it is that I do. So I'm a gastroenterologist. I'm a stomach doctor. I'm the person who does the colonoscopies and stuff like that. And I got into being a gastroenterologist really because I know people who've had colon cancer. So I've had family members who've had some issues, and seeing their experiences, really helped stimulate my interest in the field, primarily because I don't like seeing people get colon cancer, especially because that's something that's preventable. Another reason why I got into nutrition, for similar reasons. I grew up here, in the Chicago area, and I grew up seeing a lot of people get diabetes, even within my own family. And I thought diabetes was so common that it just came along with age. Like everybody just gets diabetes because that's what happens when you get older. And that is extreme. That's false. That's blatantly not true. And, nobody, with the exception of people with type 1 diabetes, no one should get diabetes, type 2 diabetes. It really shouldn't happen. We have control in terms of preventing that. And I remember being a kid going to church on Sundays, and every Sunday you hear somebody sick and shut in with diabetes or heart attack or stroke. And for me, I just always thought it was so odd. Like, why are all these good people getting all these conditions? You know what I mean? And I definitely believe in the power of prayer. But when I was a kid, I used to ask, like, why is this happening to so many people? Like, can we pray for prevention? Or can we do stuff also to help prevent some of these diseases, as opposed to solely playing about it when people actually fall victim to them? So for me, I grew up with this prevention mindset. And when I went to medical school, I learned that nutrition played a role in a lot of these conditions, but no one really had any of the fine details. So I would go to these lectures I went to Northwestern, one of the best med schools in the country. But I would go to these lectures and I would hear African-American men have the highest rates of prostate cancer, and it may be because of nutrition. And I'm like the only black man in the class, and I would ask a question. I'm like, well, I don't want to get prostate cancer, so what is it about nutrition? And no one would have the answers. So I realized I was on my own. I had to figure this out for myself. So I had to do my own intensive study, which also included going to culinary school, because you can't talk about nutrition if you don't talk about cooking, basically. So these are all interrelated. And originally, when I brought this up to some of my mentors, because I have also a research background, so I've done a lot of immunology research, and we're going to talk about immunology. Can you hear me?
Yeah.
Okay, good. So when I told my mentors I was thinking about learning more about nutrition and going to culinary school, everybody thought I was crazy. They were like, you're going to throw your medical career away. Like, why would you do that? This is quackery. And I'm like, there's so many people dying from foods. I want to learn how to combat that, period. And I didn't let my mentors, or quote unquote mentors, discourage me from pursuing what I thought was the best thing to do. So I actually started giving out recipes to patients before I went to culinary school. So I had a patient at the VA hospital, a veteran. He was a Vietnam veteran. This was some years ago. So at that time, he was probably in his late 50s, or maybe around 60. But the brother just got divorced. His wife left him because he had erectile dysfunction. He had diabetes. He had high blood pressure. He was a little bit overweight, had a mild stroke, but he was still getting around just fine. And I saw him for the first time as an intern. So when I went through his chart, I saw all these problems, and I looked at all the other doctors' notes who was taking care of him before me. And all I saw was that they just increased his medications. Every time he saw a doctor, they would just add another blood pressure medication, or they would increase his insulin. But I didn't see any notes from a dietitian. I didn't see anyone comment on what he was eating. I didn't see anyone comment on whether or not he could afford food, whether or not he lived in neighborhoods that have grocery stores. So for me, when I saw that for the first time, I asked the brother, I'm like, bro, you know, what are you eating? And what I like about being at the VA hospital, a lot of the patients are Black men. So I can have just a regular conversation like I would with any of my friends. So I'm literally like, bruh, like, what are you eating, man? Um, and he basically was just like, I'm eating hot dogs. And he said every day, every meal, just hot dogs. So I wrote down a recipe on a napkin for how to roast vegetables. So I told my man how to roast vegetables. He said he likes broccoli. He says he likes cauliflower. And he went home and, you know, to my knowledge, every meal, every day, he just ate roasted vegetables. So that wasn't really my instructions, but that's what he did. And I saw him 3 months later, or maybe even 6 months later, he lost like 30, 40 pounds, blood pressure. You know, I asked him what he was doing. He was just like, man, I just been eating those roasted vegetables. So we added some exercise to his routine. We diversified his diet a little bit more, added some more protein, a variety of vegetables. And I was able to get him off some of his blood pressure medication, pretty much all his blood pressure medications. We got him off insulin and got it to the point where his blood sugar was pretty much controlled with just pills for the most part. And what I saw in that moment, like the food and the exercise did more for him than all the medications that were prescribed previous to me. And that really what inspired me to actually get more involved in nutrition, despite what, you know, quote unquote, my mentors and everything said. So I actually stopped doing lab research because I thought I would be more effective as someone being a nutrition advocate, as opposed to, you know, being in the lab somewhere and doing experiments on mice. So that's kind of my story.
That is a great story, and something I think we can all relate to. Is like people get in a habit. He's just eating hot dogs, and you give him something else to eat. He just ate that and lost 40 pounds. So this is what we need to hear. These are the exact kind of things we need people to know, that we can manage some of these health crises by changing our diet very directly.
Right. And then
so next I'm going to have Curtis Franklin. Were you going to say something?
Yeah, just one more thing. So I also do clinical nutrition. So I have a lot of patients with cancer who have, you know, tumors that are obstructing their intestines, so they can't really eat the normal way. So we have to figure out how to do feeding tubes and stuff like that. So a lot of these people who have been gunshot victims, unfortunately, that happens. So where people, you know, literally just can't use their intestines because they've been damaged by a gunshot, and we have to give them IV nutrition. So I'm the person who does all that. So a lot of my patients, a lot of my younger patients, I literally have some of the patients who've been shot that you just don't hear about. Like, their stories go away, but those wounds stay for a long time, and someone has to help them through that. So that's one of the things that I do too.
Wow, that's another thing, right? We don't think about that unless we know someone in that situation.
Oh, it's rough.
So, thank you. Well, so next I'll have Curtis introduce himself. And actually, I do want to say that Curtis is my trainer when I train. And I'll also say that he has a great program. I'm just going to have him give his background and his story and what he does for exercise. But I can attest to the fact that when I do exactly what he says, it works. So the hard part is listening and doing it. So Curtis, how about you tell us how you got into this, a little bit about your what your routine is, the things you do, how you motivate people, and just a little history.
Oh, okay. Well, first of all, it's a blessing to be on this panel, and his story was just really right up my alley. I run across a lot of those people that he discussed, and I'm like, wow. Talking to him was like talking to a best friend of mine just last week about that matter, him having found out he had diabetes. I'm like, yo, you know, I feel bad about training best friends. I just haven't been mentioned. We have to really pay attention and take care of one another. Regardless, you know, and his stories, what he was saying, hit home. I just want to say that I actually stumbled upon the fitness. That wasn't my thing to do at all. I actually was working. I actually was an ex-athlete, and over a course of time, they say if you don't use it, you lose it. And what happened with me is after high school out for me. And I end up getting into a position of having a dead end job. So every day I go to this job, I will actually just really get sickened by the scent and the smell of the job itself. And one day as an adult was the first time I actually had tears in my eyes in the parking lot. I was like, Lord, please do something. I don't want this job. I couldn't do it anymore. It was really stressful. I go into this job, and as I was carrying 250-pound bags, because I was just basically manufacturing worker, and I fell and did a full complete split. And I wasn't built to do a split at that time at 250 pounds at that time. And what happened, I was injured. I couldn't work. And at that point in time, the rehab that they gave me wasn't really great rehab whatsoever. And I couldn't work at all. So I spent times in the local parks coming up with different ideas to do that were different from lifting weights, different from lifting anything heavy over my head, because that's all I've been taught playing sports, squats and the deadlifts, but I couldn't do that anymore. So over a course of time and doing some reading, there wasn't much online 17 years ago. So I did a lot of reading, and what I came up with was different type of exercises to do in the park. And a few people were riding past and said, hey, can I join you? And after a while, it was time for me to go back to work. And they say, hey, you know, we'll pay you for your time. I'm like, well, wait a minute, I might have something here. But at that time, as I started transitioning to be a personal trainer, something happened. What happened was I was still overweight. And I didn't know how to get this weight off. How can I become a trainer? And now I'm making this money over that summer, making the transition. So I quickly enlisted in a fitness professional program at a local community college. And I just really dove into different things, ideas, not only about working out, but like he was mentioning, people need to realize your nutrition is number one. What you feed your body is what you're going to get out of it. Point blank, period. You can't get around it whatsoever. You really can't. And when I learned the basics of, the good fats, the bad fats, the carbs, the protein, because years ago, we were just always taught protein and creatine. And I started experiencing problems with my kidneys and liver over the years of not drinking enough water. And that's how I got to be a personal trainer. Me being a dead end job, me getting injured, and me wanting more education, because I've always felt, I understand you guys might laugh at me, but I don't getting the body you want is necessarily about you spending 2 and 3 or 4 hours working out in the gym. It was all nutrition, and it was a lot of spiritual with that. And with that said, I've opened up 3 or 4 different locations over time. And I've had the blessing to train housewives, ex-athletes, current athletes, Commissioner Miller. And the thing about it is, like his story, you learn so much from different people. So even though I've been doing this 17 years, I'm still learning. Why? Because like Doctor said, everyone has a different story. And before you even embark on any type of nutritional program, I tell people all the time, I'm not a personal trainer. I'm a fitness professional. And my job is to tell you, consult your doctor before you go out there. And he would tell you before you start trying all these diets, because it might not work for you, because you might not be able to handle a high protein diet. You might not be able to handle a high carb diet, because your blood pressure, what have you. So my first thing to tell everyone is to always consult your doctor first before you consult a personal trainer, because there's many personal trainers out there. But where I'm at now in this fitness business is they call me a fitness professional. I consult with the doctor that just got through speaking on clients in general, whether they're his clients or not, because I do not know your blood pressure. I do not know your background. So therefore, Ms. Miller will tell you when you come into my place, I have a thick piece of forms that take you about 15 minutes to fill out. And that's what dictates to me if I'm able to train you and who is your doctor that I can contact. So this is how I got into personal training, was my own personal struggles with my own weight.
Well, that's another great story and personal testimony. Go ahead, Dr. McDonald.
So I was going to say, I love that story. And honestly, I think if we're trying to move healthcare in the future to really make it something that actually helps a lot of people, we have to have a better relationship with physicians and fitness professionals. Like, we have to work together, and it has to be something that these insurance companies should pay for. It should be something that's easy. I should be able to communicate with the fitness professionals the same way I communicate with any of my other consultants, especially if the goal is to make people healthy and also prevent disease. But I love the brother's story. I have a weight management clinic, so I work with a lot of personal trainers. And Curtis, I want to holler at you, man. And another thing for me as a physician, I have a personal trainer. Okay, it's not a game out here. I played sports. I played football in high school. I played at Marian Catholic back in the day. But I have a personal trainer because there are people who know more about fitness than I do. And I'm humble enough to recognize that. But I'm also smart enough to recognize that my body, especially as I age, I have to hold on to this muscle mass. Because as I age, if I don't hold on to the muscle mass, it's going to be harder to get it back.
So, okay, Dr.
And
McDonald,
one quick thing I want to say.
Go ahead, Curtis. Sorry.
No, I just want to say that it was very important for people to also understand when I say consult your doctor, that's just not sound professional. Donna, you know me, I get a little, but what happened is, I can just tell you really quickly, I actually did blood work to find out that something was going on with my body from taking these supplements. And I think I told Ms. Miller that I had to stop taking them. Yeah. And I found out through blood work, I was allergic to caffeine. And the caffeine was all the pre-workouts, and was wondering why I was getting these hives on my body, and where I was just holding fat on my body. And I found out I was allergic to shellfish. So I think people need to go in on a yearly checkup and get their blood work done, along with any type of allergic testing that they do at that time. So you know and understand that you might be taking supplements that might be posing more harm to you than anything.
Yeah, and we're going to talk about the supplements, because I know everyone wants to know about boosting your immune system and all that jazz. So that's something at some point I want to get into.
Yeah.
Well, that's what I was going to go to next, because I think that's an important part of the conversation right now, especially with COVID, because people are saying, okay, my immune system's low. What can I do to strengthen my immune system? And of course, you both know we can't do it like in a week. It's over time. But what can people do to start strengthening their immune system? Because the thing we have to realize that's super important is this virus, COVID-19, is not going away. It's going to be with us, but it might not be in pandemic status, but it's going to be here. So what can we do to start eating better to strengthen our immune system? Whether it's eating, juicing, taking supplements. I'd like for each one of you to talk about that. Water, I see you. I know water is the key to all life forms, it really is. Well, so what can we start doing besides drinking that water? I'll let each one of you address that. Dr. McDonald, oh, you kind of disappeared.
Yeah, can you see? Can you hear me?
Yeah, we hear you. I don't know why you.
Yeah, I can hear you.
Okay, yeah, just keep going. It probably.
Yeah, my video is still on. I didn't click it. I don't know why you can't see me. But so these are all good questions, and I the first thing I really want to do is really have a conversation about what the immune system is, because right now there's a lot of terminology that's being used on the media, and even some physicians who really don't know much about nutrition and the immune system. A lot of people are saying stuff that literally just does not make sense. And I think the first thing we do before we start trying to boost something or strengthen something, we have to have a conversation of what it is and why certain things may or may not make sense. So ultimately, our immune system it's a system. Okay, it's not just one thing. It's very complicated. Okay, the way I like to think about it is like the military. You know what I mean? Like the military, there's different branches of the military. The military is not just guns, it's a whole bunch of stuff. And the military, generals have to communicate with soldiers. There's communication. There's a whole bunch of infrastructure that goes into what the military is. And when someone says just boost the military, you got to get into some fine details to really have a conversation about what you're doing. Because if you're quote unquote boosting the wrong thing, you may not necessarily be helping yourself. Like case in point, you look at the COVID situation. We spent all this money on guns, but the biggest threat to our society wasn't not having guns. It was not having, the proper protective equipment or the proper ability to screen people, etc. So our immune system is complicated just like that. And just to give you a good example, a lot of African Americans, we have higher rates of lupus and also conditions like multiple myeloma. And these are autoimmune conditions where, multiple myeloma is a cancer, but both of those situations are where our immune system is almost overactive. And that's not an immune system that needs boosting. If anything, we need to suppress that inflammatory response or the immune response in those conditions. So I see a lot of folks like, I got to boost my immune system, but I'm also taking these anti-inflammatory medications or supplements. And it's just like, wait a minute, this doesn't make sense. You're trying to boost something, but you're also trying to suppress it at the same time. So I tell people we really should focus on having a healthy immune system. And that makes way more sense than just boosting it, because, if you're trying to do something that's going to increase your white blood cells, well, leukemia is having a whole bunch of white blood cells. And if you boost it too much, it's going to, it may cause problems. Or even right now, most people are running around with issues with chronic inflammation. That is not an immune system that needs to be boosted. That is an immune system that is chronically overactive. And if anything, that is what's causing a lot of disease nowadays. So before we even talk about how to boost the immune system and, why your immune system needs strengthening, I think we should talk about, like, why is your immune system weak in the first place? If everyone's concerned about their weak immune system, we need to have a conversation about that. Okay, so there are some conditions that can weaken your immune system, period. So HIV would be one. HIV/AIDS, that's a viral condition that weakens the immune system. It attacks the immune system. With COVID particularly, we're seeing that people who are overweight, people who have obesity, people who have diabetes, and people who have high blood pressure are having worse outcomes with this condition, with this virus. And some of that has to do with the effect of those conditions on the immune system itself. So diabetes is something that can weaken the immune system. And it's one of the reasons why people with diabetes are at risk for infection. So you may have seen people, or may even know people, where they get a small infection in their foot. The infection, doesn't really heal itself like it normally it should. And then, a couple of months later, it gets worse and worse and worse. And then someone has to get their leg cut off because the infection just continues to spread. And when we talk about strengthening...
I think you need to say that one more time, that diabetes... Oh, I was just going to say how diabetes weakens your immune system, because that is a chronic ailment that we hear about in lots of communities of color, not just African American.
Yeah, so diabetes can weaken your immune system. When you have elevated blood sugars, your body, not only your immune system, but a lot of different organs can't function properly. So this is one of the reasons why people with diabetes are at risk for heart attacks. They're also at risk for issues with their nerves. So people get numbness and tingling in their hands and legs potentially when they have diabetes for a long time, primarily because the sugar is actually damaging the nerves. So it actually damages your body's ability to fight off infection. And this is stuff that we have seen. I mean, you've seen people with, in wheelchairs who are missing a leg from diabetes. That's because of the immune system has been affected and they couldn't fight off an infection. So the first thing I tell people, before we even talk about supplements and all this other jazz that's all over the internet and social media, it's like you got to really address what's going on with your underlying conditions. Like if you have diabetes and you're trying to boost your immune system, best thing you can do is get your blood sugar under control. And of course, we can have those conversations about what you have to do to get your blood sugar under control. But like no supplement is going to do that for you. And that's something that, exercise plays a role also in getting your blood sugar in control. If you have extra weight to lose and you're trying to boost your immune system, one of the best things you can do is put yourself on that pathway towards weight loss. But if we're at home right now, and it's tempting, I get it. What's going on right now is very stressful. It's very anxiety provoking. It's very depressing. And I totally understand how people are at home, trying to address some of these issues through food, eating some of these comfort foods that makes us feel better. But if we're sitting at home and we're eating donuts and the sweets and all the stuff that makes us feel good, but we're taking vitamin C on top of it, we're not really doing much for our immune system overall. Okay. We have to live kind of a healthy immune lifestyle as opposed to just focusing on one supplement. And like my man said, some of these supplements can be dangerous. So I go on social media all the time and I see people like, look, take this to boost your immune system. A lot of the stuff has not been studied. And a lot of the stuff is not, it's not free. So I've seen people spend a lot of money on some stuff that really doesn't have a whole lot of evidence behind it. And two, there may be some potential side effects. And three, a lot of these supplements aren't even studied by the FDA. So some of the supplements may not even have the ingredients that you think they have, because there's no laws or regulations that actually force people to actually make these supplements say what they are. And they did a study where they looked at a whole bunch of different supplements, and a lot of them had like chemicals like arsenic and all the stuff that's actually damaging to the immune system, but people were taking them to actually help the immune system. So I tell people to be careful. And I've seen folks come into my clinic and they're like, look, I've been doing, these supplements, and I check some basic labs or even check some labs for some heavy metals, and their arsenic levels are elevated. Or another heavy metal is cadmium that's in some of these supplements, that's elevated. And it's a problem. But the thing that you can do, and we'll talk more about food specifically, but first and foremost, you have to have a healthy diet. And a healthy diet really entails eating fruits and vegetables. Okay. So I know there's a lot of debate whether or not you need to be a vegetarian or you could be a vegan and all that stuff. I'm not a food shamer. Okay. So I'm not going to, shame people for eating, however they eat. However, what the literature clearly established is that fruits and vegetables are important to our body, period. And the more fruits and vegetables we do, that typically can translate into a healthier life. And there's a lot of different studies that support that. And if you want to be closer to a vegetarian, that's great, but you have to be a healthy vegetarian. Okay. You can't eat potato chips all day and not eat meat and then call yourself a vegetarian. So technically that would be a vegetarian, but that's an unhealthy vegetarian. And the flip side, I see a lot of people trying to do these ketogenic diets where they may be doing like butter and coconut oil and a whole bunch of meat all the time. But then I've seen a lot of people come in with elevated liver tests, or they have a lot of fat that's built up on their liver. So I don't think there's a one size fits all model per se, but a concept that we should be aware of. We have to eat fruits and vegetables, and we also have to limit our processed foods. So other things that can negatively impact our immune system, lack of sleep. So how we sleep is one of the biggest determinants of our immune system. So, if you're sleeping 2 hours a night, but drinking, some green tea supplement, it's not going to help you. We have to get the foundation before we start adding potential supplements on top of it. Other things that can impact the immune system, exercise plays a role. So exercise, I would say, if you want to have a healthy immune system, you have to put yourself in a position to have a healthy body. And in order to do that, fitness plays a role. And I know, he may get into some of the controversy whether or not like high intensity interval training can impact the immune system. Some of that stuff is controversial, and I still encourage people to exercise, even in the setting of this pandemic, because the exercise is going to prevent some of all the conditions that are associated with having a bad outcome. So we know exercise can lower your blood pressure. We know exercise can lower your risk of being overweight. And we know it also can help with blood sugar control, because your muscles are actually using the sugar that's in your blood as opposed to allowing it to damage some of your vital organs. So with nutrition, I think a lot of people are trying to do vitamin C. I see that all the time. So vitamin C, there's a study that showed when people take vitamin C supplements, it may decrease your risk of having a cold, or decrease the duration of having a cold for about 2 days. Okay. So, some vitamin C is not going to help. Not going to hurt you. How much it helps, especially in the setting of this virus, no one really knows. So there's some studies where even in our hospital, we're trying to get people high doses of IV vitamin C. But this is, vitamin C given intravenously at massive doses that you will not be able to eat on your own. And even still, people who are trying to do vitamin C, if you take too much and you have an underlying condition, such as there's this one condition called G6PD deficiency. If you have that, too much vitamin C could actually be deadly. And a lot of people don't even know they have that condition because it's not something that's routinely tested for. Yet people of color are at higher risk for having that condition, primarily because it may offer some benefit, some protection against malaria. So you have a lot of people out here just blindly doing these things, but people are following information off of social media as opposed to really having something that's guided based upon their own body and their own conditions and something that's specifically tailored to them, which we need to work on that in general, even within the hospitals. And to Curtis's point about caffeine, look, caffeine affects us in different ways. So they've done studies where they looked at how people metabolize caffeine. You have some people who are slow metabolizers, and you have some people who are rapid metabolizers. And what that means is some people break it down slowly, other people break it down fast. For people who break it down slowly, you drink a cup of coffee, your blood pressure goes up, and it may stay elevated for a long time. And for people who are rapid metabolizers, those are the folks who can drink a cup of coffee at midnight and fall asleep like it's nobody's business, like they didn't do anything. But we're not testing all this stuff right now. So no one really knows if they're a rapid metabolizer or not. But these are the details that we have to think about when it comes to nutrition. And it's some of the details that I'm aware of that makes it frustrating for me when I see a lot of people are trying to do this wholesale generic approach to nutrition like everybody's the same. And it doesn't really work like that. For most people, honestly, the most important thing you need to do for this virus is really cut out a lot of the junk food, cut out a lot of the sugary beverages. If you want to boost your nutrition, that is like the first place to start. Get rid of the things that are damaging your nutrition and your immune system. And also, do fruits and vegetables. So most fruits contain, anti-inflammatory properties. So it's going to decrease some of your chronic inflammation that's just going on. And, don't just eat one fruit, eat a variety of fruit. And one way you tell that you're exposing yourself to different plant-based nutrients is by looking at the color of the foods that you're eating. So typically the color of the fruit or vegetable itself, these pigments are plant-based nutrients called phytochemicals. That's the technical term for it. So these chemicals, typically have anti-cancer or anti-inflammatory properties. So one good example would be lycopene. So lycopene is the pigment that makes red food red. So tomatoes are high in lycopene, watermelons high in lycopene. So lycopene can actually decrease your blood pressure. So when they've done studies where they looked at lycopene, it can help with blood pressure. It also can help with decreasing your risk of prostate cancer. So, I've seen literally studies where they've given people concentrated watermelon juice to help lower blood pressure, and it works. So that's just one food. Green foods have other phytochemicals that are helpful. Yellow foods have other chemicals that are helpful. So if you want to expose yourself to a variety of different plant-based nutrients, eat a variety of different foods of different colors.
Well, so that's great, Dr. McDonald. I just wanted to ask you, what was the name of that test that you just mentioned that you said most people don't get?
To test to see if they're a rapid metabolizer of caffeine?
No, I think it was before that, something about the G6 or
G6PD. Yeah. So that is a deficiency for a specific enzyme. So most people don't get it because you really need to have some symptoms to actually make a doctor suspect that. So it's not a routine test. And another thing,
okay.
A lot of times people say do certain things at your annual checkup. You actually need to know what your doctor is doing at a checkup because most people don't know what's being tested at all. So allergy testing, definitely not part of an annual checkup. And even the concept of an annual checkup is starting to not be a thing. Most physician societies are actually not recommending people come in annually for checkups. So with those recommendations, and if that's the way people are being trained right now, a lot of patients or people out in the community, you really have to be aware of what you're trying to look for and what your doctor's ordering. Because I see it all the time.
Yeah.
People come to see me and I'm like, well, you don't have any blood tests. No one checked this. And everyone says, oh, I just had my annual checkup. I'm sure they checked it. I'm looking at the chart. Like, they didn't check it. Like, did you ask for it?
Yeah.
So ultimately, whenever you're interacting with the healthcare system, like you need to be aware of what's being checked, period. Because some things that you just assume are happening may not be happening.
Right. And that's what I'm going to go to Curtis now just to talk about the immune system and exercise. But Curtis, you also mentioned that testing for your allergens. And, how did you get to the point where you even knew to ask for that? And then also just talk a little bit about how exercise helps with your immune system and things you do for a new client, like someone who's just getting into exercise, because everyone's not an advanced level. Oh, wait, you're on mute. Hold on.
Okay.
There you go.
I'm good. Can you hear me?
Yes.
Hello? Okay,
yeah,
what I do
you.
here over at Body and Fitness, as clients come in, I do a complete evaluation on you where you got to fill out paperwork that has a lot to do with your social life and your health history and who your doctor is. I will contact your doctor before your first visit so we can figure out what type of exercise work good for that client. And also, the main thing people always ask me, other than the exercise, the main thing, Ms. Miller, Commissioner, is about the diet. And I want to go back to what the doctor was saying when he said we have to have a foundation. So many people are going to the Atkins diet, keto diet, whole bunch of different diets. And I've been doing this close to 20 years. And I tell people, I just want to say this. Everyone's body is different. Okay. Everyone has different goals. Everyone's not here to be a supermodel or what have you. There are different types of levels when it comes to nutrition and as well as exercise. So when you have these different diets, you got to have your foundation, and your foundation should be eating sensibly every few hours or so. But when you hit that plateau, then you can start trying different diet plans like keto diet, Atkins diets. You can try those to break your plateau. But after a while, your body gets used to it because your body is all about what? Muscle fusion. So now when you're done with your few months doing these different type of diet phases, you need to come back down to this foundation where you started from. Okay, because you cannot keep doing low carb, high fat diets. Okay, you got to have a sensible all around diet. And if you're going to do that, do it for a short period of time. It's only to break through a plateau. And when you talk about boosting your immune system, so many people don't realize that when you realize that you want to boost your immune system, whether you go to a doctor and you find out, like I did, what you are lacking, what have you, you have to look at your citrus fruits. That's good in vitamin C. Look at your broccoli, look at your spinach, okay? And you actually, I got to understand, and a doctor touched on this also, before you start taking these supplements, why don't you try to eat what you need, because your body will break it down much better and faster. And you will be able to digest it, and your body will be able to utilize that a lot better than you taking the supplements. Okay, why get addicted to taking supplements when you can just go ahead and eat your food, and everything will be a lot better for your system that way. And another thing that people need to realize is that I, for one, I'm going to expose myself, tell you, when you talk about vitamin C from like your oranges, your grapefruit, and your tangerines, those are high citrus things that actually will help you burn fat. But when you're taking those for a longer period of time, a large amount, you start having issues with the linings of your stomachs and things of that nature. So you really have to watch it. Like the doctors say, everything is in moderation. That's key. So now when you talk about exercise, I just wanted to get that out the way because that's like the number one thing people ask me. I just tell them, hey, listen, if you're going to change your diet, one more quick thing, You cannot be all over the place with your diet. If I give Miss Miller a diet and she says, well, Curtis, I went to go do something a little different, it's going to be hard for me as a professional to make adjustments all over the place. You got to be consistent is the key. And you got to also remember, like the doctor said, is 1 or 2 servings of fruit, 1 or 2 servings of veggies a day, you'll be just fine. And eat your little meat here and there. It really depends on your body, but you have to be consistent.
Yeah.
And when it comes to working out, people need to realize that your workout doesn't mean that you have to be sweating profusely for it to work for you. Everyone is like built differently. There are so many things that you can do in your home, outside, especially during the fact that a lot of people are really dying to get into these gyms, and you're literally going to end up dying for real if you go to some of these gyms, because a lot of people are not well. You got to have your social distancing and what have you. But we have to realize that you can sit up there, and even though you're exercising at home, it may not be as intense as in the gym, because what makes the gym more intense than your home? Because when you're home, that's your home where you relax, right? And you get more intense and more of a workout when you know people are watching you. But at the end of the day, if you're not able to have that intense workout at home, then therefore you need to start practicing more on your diet. That is key. Practice more on your spiritual awareness, practice more on your diet, and start visualizing the body that you want, and you go for it. It's just as simple as that. From your simple push-ups, instead of you counting your reps, you should just do them for 1 minute at a time. 1 minute on your jumping jacks, 1 minute on your squats, 1 minute on your calf raises, 1 minute on your plank holds. Everything, do it for a minute, because your body is used to you counting 1, 2 jumping jack. You just got to go ahead, and I always tell people that there are a lot of people, I send to people and say, hey, follow these people. They giving you some. Get your trainer to get him updated, and get you a site in which you get you an app. I have my own app that I give the clients that they can follow. And if they don't know how to do the exercise at home or what have you, you can click a button. They can show you how to do it. But exercise, you don't need to overdo it, guys. You don't need to exercise every day. You don't need to do your abs every day. Your abs are definitely made in the kitchen, eating sensibly, and learn like what the doctor said. You must get your rest. You shouldn't take any type of caffeine or hot, what have you, a couple of hours before you go to bed, because your body is going to be up. It's not going to allow you to. So the whole thing about this all that I can wrap up and tell you guys is sleep, nutrition, and workout in that order. If you have 2 hours and
Uh-oh, we lost you, Curtis. We can't hear you.
Yeah. All right, I can jump in.
We couldn't hear the last part.
Is he back?
I don't know what happened.
So I agree with everything
No,
he said.
Curtis, we couldn't hear the last part.
Yeah.
Go ahead.
So I agree with everything he was saying, and especially the part where he mentioned eat sensibly. Okay, so a lot of times people ask me, specifically, like, look, tell me what supplement I need, tell me how much zinc I need, how much vitamin A. The bottom line is you have to have a sensible approach to eating, and a healthy approach to eating before we start getting into all these specific details. Because once you start focusing on how much zinc and how much vitamin C, it makes it way too complicated. It turns eating food into a science project as opposed to a pattern of eating. So, and even still, a lot of these supplements that people are trying to get on, specifically some of the vitamins, at some of the high doses, studies show it may increase risk of certain things. So there was one study where they looked at vitamin A. So they were giving people with vitamin A to see if it actually helps lung cancer. So they had thousands of people, they gave them vitamin A, and they assumed that the people who received vitamin A, their lung cancer would actually be better than the people who didn't. And lung cancer was way worse in the vitamin A group, and they actually had to stop the study. Another thing that we haven't talked about when it comes to nutrition is the effect of smoking and the effect of drinking too much alcohol on your immune system. So, can you hear me?
Hello?
Yeah.
Okay, yeah.
So smoking cigarettes is one of the worst things you can do for your immune system. I mean, it's the worst thing you can do for your health, your body in general. But a lot of people out here, you know, if you're trying to smoke cigarettes, that creates, I mean, you're literally inhaling smoke and, you know, substances that can cause inflammation. Like you should, if you're trying to put your immune system in the best position to fight off anything, you have to stop smoking. Um, and with alcohol can also suppress our immune system, especially when you drink too much of it. So, you know, your glass of wine every now and again, that's not going to do anything. But if you are you know, I'm drinking a whole bottle of wine every night, or I got to have, you know, 3 and 4 shots of this every night, or I'm drinking my 6 pack of beer, or, you know, etc. Like that's not doing anything for your immune system. And it's going to be hard for your diet to overcome all that. Now, with nutrition and your immune system, honestly, we have a lot to learn in terms of like what's really going on. But there is a connection. Okay. So you may even see a lot of physicians say, oh, you know, that's all garbage, blah, blah, blah. That's not true. So what you eat and what your immune system does, they are connected. And we know that for a couple different reasons. So we know that malnutrition definitely can lead to a deficient immune system. So even right now in the hospital, so we'll have surgeons who'll come to me and say, look, I want to do surgery, but this person has to improve their nutrition before I do the surgery because they're so malnourished. If I did surgery right now, they won't heal up and they're at higher risk for complications. And we also know that people who have malnutrition, they have longer hospital stays. Their hospital stay is more expensive. They have a higher risk of picking up community or hospital-acquired infections. And they also have a longer stay in the ICU, and there's an increased risk of mortality. So we pay a lot of attention to nutrition in the hospital setting. But that's really addressing malnutrition. So as far as how do we use food specifically to modify our immune system is super complicated, but there's definitely a role that we still are actively studying. And one of the reasons why food definitely plays a role with the immune system is because your gut, your intestines, that's the biggest immune organ in your body. Okay. A lot of people don't even know that the intestines are your biggest immune organ, period. And when I do colonoscopies and I'm actually looking inside of people's small bowel or colon and their intestines, you could even see concentrations of immune cells. So they look like little bumps on the intestine. Like and these are cells. I shouldn't be able to see these microscopic things, but they're so concentrated in the intestine, I can actually see them with my own 2 eyes when I'm doing procedures. So yes, food can play a role. Your gut bacteria can play a role when it comes to the immune system. So I know a lot of people are trying to get on probiotics and they ask me like, Dr. McDonald, what probiotics should I be on? The answer is we don't know. It's complicated. And I actually work with a lot of the probiotic or bacteria researchers here at the University of Chicago, and they will all tell you we don't know. But we do know that eating a diet that's diverse in plant-based foods actually improves the diversity of your bacteria in your gut. So the more the different types of plant-based foods that you eat, the higher variety of bacteria you're going to have in your gut. And that variety really shows that you have a healthy combination of bacteria. But when you don't have a whole bunch of bacteria, it really shows that you're not really feeding your bacteria. And the way to feed the bacteria within the gut is basically to eat foods that are high in fiber. So we don't absorb fiber. So majority of that fiber and whatnot gets down into the colon, where the bacteria can start to digest it. And those bacteria, again, they interact with our immune system. So you want to keep your bacteria fed, but you have to eat foods that have fiber. And things that can decrease the diversity of your bacteria. You know, you have to be careful for a lot of the processed foods and a lot of foods that have a lot of chemical ingredients that we don't even really understand. So you've seen these processed foods, when you look at the ingredients, you almost have to have a PhD in chemistry to understand what you're eating. Like that's not the stuff that's going to help your immune system. You know what I mean? Like it's just not. And majority of that stuff is not studied. And when it is studied, especially in mice models, it causes problems. So there's a lot of emulsifiers that are in the foods that we eat that a lot of researchers give to mice to cause inflammatory bowel disease in mice. So we give some of the stuff literally to cause disease so that we can study it, but it's in our food right now. And people are eating some of this stuff thinking that it's A-OK. Just because something is just because the FDA says it's generally recognized as safe, it doesn't mean it's okay. That just means we haven't studied enough to say one thing or another. And a lot of our foods fall into that category, and like that's a problem to me. But when it comes to just eating plain old food, you know, like people have been eating oranges for thousands of years. Like oranges have a good track record. Like an orange probably not going to hurt you. Kiwi's been around for a long time. You want to get your vitamin C? Eat some kiwi.
So Dr. McDonald and Curtis, we could have a whole nother hour because this is also fascinating, but we're wrapping it up. But there was one question about what are your thoughts on eating on wheatgrass?
I mean, it's a plant-based food, so I like it. I will put it in the category of, you know, spinach, kale, any other plant-based food. But specifically eating wheatgrass and thinking that it's going to do something magical, I wouldn't recommend approaching things that way. So I wouldn't recommend focusing on any one ingredient, and I recommend people focus on their pattern of eating because that's where the true power is. So a lot of times people ask me like what I think about this ingredient. It's your overall lifestyle and your overall pattern of eating that's important. Like one ingredient is not going to make you or break you, but it's one ingredient in the context of a whole bunch of other ingredients, or in the context of not sleeping, in the context of smoking cigarettes and drinking a whole bunch of alcohol. Like that's where the problem lies. And also in the context of just sitting all day. So just sitting all day and not being active, that in of itself is pro-inflammatory. So a lot of times we just sit at, you know, we have these jobs where we're just sitting. The sitting is not safe. Like we have to get up and move around.
Well, I will say, so my mother used to grow wheatgrass and juice it every day, and she swore by it like it was the healthiest thing ever. So, but that was someone else's question. So just to wrap up, so I'll go to Curtis, and then I'll let you think about it, Dr. McDonald, because I want to see if there's any resources you guys would recommend. You don't have to know them right now because we can put them in the chat later, like for people to read or people to look up. So Curtis, what are like the top 3 things you would say for someone to do if they are really just getting started? I know water is number 1, but like what else should people do? And both of you kind of mentioned like routine and consistency are really the key. But what would you say from your professional opinion? Oh, wait, you might be on mute again. We can't hear you. Hold on. Are you muted?
All right, looks like he's unmuted now.
No. Can we hear Curtis? I don't know what's going on. We can't hear you. Okay, well, sorry, Curtis. We can't hear you. I don't know. Okay, so Dr. McDonald, what would be 3 things you would say are to do?
Okay, so I mean, with Curtis, I think Curtis would say increase your physical activity, but just be mindful of your body. So I agree with him. You don't have to hurt yourself. So I know some trainers who are, you know, telling me like they have their people they're training vomiting during sessions and whatnot. Like it doesn't have to be these extreme workouts, but you do have to be active. And I tell people based upon some of the exercise guidelines, we recommend like 150 minutes per week of moderate exercise as a decent goal to start, especially for people who haven't been working out. And I mean, you could even start with walking, but like doing something is way better than doing nothing. Definitely get your sleep. So, you know, most of the medical guidelines that I look at recommend at least getting 7 to 8 hours. So if you sleep too little, that's not good. If you sleep too much, that's also not good. So people out here sleeping 10, 11 hours thinking that they're doing their bodies a favor. It's not. So 7 to 8 is really the sweet spot. When it comes to eating food, eat a variety of fruits and vegetables. Okay. And if it's a vegetable, it's probably good for you. Like, I know that sounds very simplified, but the problem with nutrition right now, we have made something way more complicated than what it needs to be. Okay. Like, people are trying to like calculate their macros and all that stuff. It's one thing if you're trying to be in a bodybuilding competition and you're trying to look 100% perfect. I get it. It's like some of those details matter. And, if you're an athlete, you need to be aware of how much protein you're taking in. But for the average person, you just have to eat real food and a variety of it. And right now, when you look at studies, a lot of people aren't even cooking. So there was a good study that showed like 68% of Black people only 68% of Black people are cooking, compared to like 75% of other ethnicities. So for people who are trying to take control of your health, the best way to take control of the food that you eat is actually to prepare yourself. So if you're worried about exposing yourself to all these, foods that cause inflammation and stuff like that, you got to cook the stuff on your own, because now you're in control. Another thing that I tell people, if you're trying to boost your immune system, do the things that are damaging the immune system. Okay. So stay away from the cigarettes. Don't drink a whole bunch of alcohol. And then you also have to get your underlying conditions controlled. Okay. And for some people that may entail using medications. And I know a lot of people are like, I don't like medications. Well, you shouldn't like medications. Like, I don't want to be on medications, but I try to live a lifestyle where I don't need medications. So for folks who don't like taking medications, one, you have to try to live a way where you don't need it. And if you do need those medications, that's a conversation you need to have with your doctor. And I've seen people like, yeah, I'm not going to take this cholesterol medication, but then they're doing some of this natural stuff, which I understand. I mean, there's some evidence for red yeast, rice, blah, 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 blah. But someone still should be checking your cholesterol to see if it's working. And if you're taking garlic for your blood pressure, like, I encourage that. But we have to check your blood pressure to actually see if it's working. Just the same way I would do any medication.
Right.
And that applies to food. So I would say, talk to your physicians, or, your nurses, your healthcare workers, et cetera. But you also have to find someone who's knowledgeable about nutrition and food. Now, the sad reality of our healthcare system, most people don't know anything about food. And that's the truth. So like, most of my colleagues, most doctors don't know anything about nutrition, absolutely nothing. And that's something that we're changing. And we're probably even going to need some legislators that kind of help out with that process and push the healthcare system in the right direction. But that's a whole separate conversation.
Well, I agree with that. And we are at the end of the hour. So thank you both for sharing your expertise and so much knowledge. It's really a good starting point for people to get started. It's great that you two didn't even know each other. You're speaking the same language because you're on the same path, and nutrition is the key. Exercise is the key. Talking to your doctor, having some kind of routine. These are such important messages, I think, that everyone needs to hear. You don't have to overdo it, but you'd have to do something. So I think we can continue this conversation another time, which would be fantastic. Thank you, Dr. McDonald.
Can I say one more thing?
Oh, yes.
Yeah. I have a website where I talk about nutrition, thedocskitchen.com. So I'll explain.
Yeah, we did post your website up.
Okay, yeah. So I'll explain about the immune system, everything on there. And Curtis, man, we should connect. I want to connect with you.
Well, I'll make sure you guys connect. Okay. So sorry, Curtis, I don't know what happened, but thank you for explaining everything from your point of view. And thanks everybody for listening. Share this because it will be on my Facebook page and you can share it later. And even beyond this conversation, it really is a good conversation to keep having. Okay. So thanks everybody. Have a great day.
All right.